Good day. I am Mark Clement Alpabelona, and I will be giving a lecture using audiovisual presentation. So, first of all, welcome everyone to Soxarjan General Hospital. For today, I would like to impart to you the tool that we use for documentation, which is the FDAR or the focus charting. It is the SOPI's successor, by the way. So, let's start. So there are three types of most commonly used documentations. So first is charting by exception. So it contains a list of normal findings. So after performing an assessment, nurses confirm normal findings on the list found on assessment and write only brief progress notes for abnormal findings or to document communication with other team members. So it's like a checklist. It is more commonly used at ER. Next, or would be the oldest type of documentation, which is the narrative notes. It is like a diary of the whole shift events. And the other one, the SOPI, so it is the predecessor of the FDAR. So it contains the subjective, objective, assessment, plan, interventions, and evaluation. So it is written by nurses as well as other health care team members. So the highlight of our lecture for today, the FDAR. So it stands for Data, Action, and Response. Focused DAR or the FDAR notes are brief. So each note is focused on one patient problem for efficiency in documenting and reading. So, isang problema natin sa healthcare situation dito sa Pilipinas is maraming pasyente. So, using the DAR would shorten the time for or yung time para sa papel and more on patient care. So, it is intended to make the client and client concerns and strength the focus of the care. So it is also a method of organizing health information in an individual's record. So it is also a systematic approach to documentation. The progress notes are organized into three columns. So the first column would be the date and time. Next column would be the focused, and lastly the DAR. So it stands for the data, action, and response. So the next slide, here is an example of a format of focus charting or FDAR. So as you can see, first column, date and time. So it is important for the documentation to be next, the focus of care. So this may be a nursing diagnosis, a sign or a symptom, an acute change in the condition, or any behavior. So the third column, the data, action, and R for response. So the data category is like the assessment phase of the nursing process. So in this category, pwede nyong ilagay vital signs, behaviors, and other observations noticed from the patient. So both subjective and objective are recorded in the data category. The action category reflects the planning and implementation phase of the nursing process and includes immediate and future nursing actions, independent and dependent nursing action, and it may also include any changes to the plan of care. Lastly, the response category reflects the evaluation of phase of the nursing process and describes the client's response to any nursing and medical care. In short, ito po yung evaluation phase na, for example, anong response ng ginawa mo sa pasyente. Halimbawa, sa action mo, nag-TSB ka. So, ang R niyan, depende kung bumaba ang lagnat niya or hindi. So, that's the response category. So this is an example. This video is an example of furnishing nurses' pregnancy notes using FDAR.
Hello, student nurses. I'm student nurse Brian. For today, I will be discussing to you on how I create my FDAR. So FDAR stands for Focus, Data, Action, and Response. So in doing your nurses progress notes, you need to include the date and the time para malaman po natin kung kailan siya ginawa at kung ano pong oras. So yung FDAR po kasi is associated sa NCP. Mas pinadaling NCP po siya. So for example, ang focus po natin is hyperthermia. So ang hyperthermia po, there is an increase in the body temperature po, the normal body temperature, which is 36.5 to 37.5 in Celsius, 97.8 to 99 in Fahrenheit. So, if there's an increase in body temperature, yung data po natin is ano po yung information ng patient's current status. This includes po the subjective and the objective data. So, nag-include po ako dito ng reports of not feeling well, body temperature of 38.5 degrees Celsius, and restlessness. So yung action po, this is the action the nurse takes in response to the data. So ano po ba yung pwede natin gawin as nurses para mag-stabilize yung body temperature po ng patient po natin? First, we can perform tepid sponge bath. Next, we administer paracetamol 500 mg per tab. Nag-use din tayo ng music therapy as relaxation kasi music relaxes the mind and body of our patients. We need to also to monitor input and output. So, yung response po, ito po yung naging evaluation po ng ginawa po nating action. So, yung response po natin is patients feel relaxed and calm. Bakit naging feel relaxed and calm? Gawa po na nag-introduce tayo ng music therapy, bumaba po yung temperature niya, nag-decrease po from 38.5 to 37.9. Yun lamang po. Maraming salamat.
So that's an example of filling up or documenting using the FDAR. So after nitong video na to, meron akong exercises for us to discuss. So it is FDAR activity. So sample activity. So this is a fully furnished focused charting. So merong date and time. The focus is fever. Data, temperature 38 degrees Celsius, skin warm to touch, flushed skin, dry lips, and irritable. So the action, continuous TSB, increase fluid intake, avoid drafts and cold, comfort measures, cold compress applied to forehead, antipyretic medication as ordered. So, nung 12 noon, afebrile na siya. So, temp 37.5, affix your signature along with your license number. So, this one, blank po lahat. So, kailangan nating i-furnish. So, date and time, 4 p.m. So, reported focus, pwede dito, acute pain. So data, reported pain scale of 8/10, guarding position, crying face, grimacing, irritable, unable to focus, poor appetite. So anong possible na action na gagawin? So first, gawin muna natin yung non-pharmacological na intervention. So possible dito sa A is place on bed with pillow support. Kasi nga yung pillow, makakause siya ng comfort. Pwede din na ilalagay dito na provided comfort measures like ano ba? Provided rest conducive environment for the patient. Then next, let's say ketorolac 30 mg IVTT given. Then sa R, pwede natin ilagay, ask nyo if na-relieve. Kasi nilagay nyo sa D, sa data ninyo na merong 8/10. So in return, sa response nyo, dapat meron ding scale kung bumaba nga o hindi. So next, affix your name and signature along with your license number. So here's another problem. 2 p.m. So focus the data, sleep with right-sided weakness, occasional dizziness as verbalized. So pwede dito is ang safety. So sa A natin, pwede natin ilagay dito na the usual safety measures. So placed on the center of the bed, side rails raised. Pwede dito na assisted in activities of daily living. And sa R, so pwede natin dito na syempre safe yung patient, negative or no injuries noted. Your name and affix your signature, then license number. So that's all. I hope may na-learn kayo sa lecture ko. And once again, welcome to SGH and thank you for listening.